Drug distribution system in a hospital. Let us see dispensing of drugs to inpatients. Upon completion of the topic, the student shall be able to understand dispensing of drugs to inpatients and to know types of drug distribution systems. First point, dispensing of drugs to inpatients. There are number of steps to dispense the drugs to inpatients. These are: in a hospital, physician prescribes, pharmacist dispense, and usually nurses administer drugs for inpatients. After receiving prescription from physician for inpatients, nurse prepares requisition of drugs from pharmacy. In pharmacy, drug is compounded if required, pre-packaged and labeled properly, and then distributed to nursing units. Then nurse prepares drug for administration for individual inpatient and write this information on patient's record. There are number of methods of drug distribution in a hospital. There are 4 systems of drug distribution to inpatients used in various hospitals according to the size of inpatient, availability of professional personnel and budget. These 4 methods are individual drug order system, floor stock system, combined individual drug order and floor stock system, and unit dose distribution system. Now this is the flow chart for methods of drug distribution. The first method is individual drug order system. Second is floor stock system. It is divided into 2 types, that is charge floor stock system and non-charge floor stock system. Non-charge floor stock system again subdivided into 2 types, that is drug basket method and mobile dispensing unit. Third method is combined individual drug order and floor stock system. And last one is unit dose distribution system. This system again divided in centralized unit dose distribution system and decentralized unit dose distribution system. Now first type, that is individual drug order system. In this system, doctors write a prescription and the patient is asked to get the medicines from licensed medical store. This system is generally used by the small and or private hospital because of the reduced manpower requirement and the desirability for individualized service. Advantages of these systems are: medication orders are directly reviewed by pharmacists. It provides better interaction among pharmacist, doctor and patient, and it also provides clear control of inventory. Disadvantages are: in this system, there may be delay in obtaining the required medication. Second type is floor stock system. A floor stock system in a hospital involves the storage of pharmaceutical and over-the-counter drugs where they are needed, usually in a nurse station rather than in a pharmacy. According to this condition, the nurses store the drug and administer them to the inpatient according to the physician's order. A floor stock system is used to avoid the time required to get necessary medications from the pharmacy to the nurses who administer them. Rarely used or particularly expensive drugs are omitted from floor stock. Only the commonly used drugs are taken in this system. Under this system, the nursing station carries both charged and non-charged patient medication. Advantages of floor stock system: ready availability of the required drugs, elimination of drug returns, reduction in the number of drug order transcription for the pharmacy, and reduction in the number of pharmacy personnel required. Then disadvantages of floor stock system: in this system, more human errors involved with dispensing drugs because they bypass the pharmacist. Increased hazards associated with drug deterioration, lack of proper storage facilities on the ward, and increased workload on nurses. Drugs on the nursing station are known as floor stock drugs. Floor stock drugs again divided as charged floor stock drugs and non-charged floor stock drugs. Charged floor stock system: in this system, the medication stocked on the nursing station at all times. They are charged to the account of patient after they are administered. Selection of these drugs is made by PTC, that is Pharmacy and Therapeutic Committee. An envelope is used to dispense such drugs. Now second is non-charged floor stock system. These medications are also stocked on nursing station at all times, but they are not directly charged to the patient's account. Their cost is calculated as per day cost of the hospital room. There are two methods of dispensing of non-charged floor stock drugs. First is drug basket method and second is mobile dispensing unit. Now drug basket method: under this system, night nurse checks the medicine cabinet, utility rooms and drug supplies. Nurse fills the requisition form for the floor stock supplies and places empty containers in the drug basket. These are then sent to the pharmacy. The pharmacy staff fills each container and dispenses the requested ampoules and vials as ordered and delivered to the floor. These are some images of drug basket. Now second is mobile dispensing unit. It is a specially constructed stainless steel body. Nursing unit send a copy of requisition order to the pharmacy. The pharmacist controlling the mobile unit checks the items and quantity of supplies left in the drug cabinets, and drugs are dispensed via the mobile units. These are some images of mobile units. Now third main type is combined individual drug order and floor stock system. This system utilizes an individual drug order system as primary means of dispensing along with a limited floor stock system. This system is probably the most commonly used in hospitals today and is modified to include use of unit dose medication systems. Now last type is unit dose distribution system. Unit dose medications have been defined as those medications which are ordered, packaged, handled, administered and charged in multiples of single dose units containing a predetermined amount of drugs or supply sufficient for one regular dose application or use. Advantages of this system: first is patients receive improved pharmaceutical service 24 hours a day and are charged for only those doses which are administered to them. All doses of medication required at the nursing station are prepared by the pharmacy thus allowing the nurse more time for direct patient care. This system allows the pharmacist to interpret or check a copy of the physician's original order, thus reducing medication errors. Elimination, excessive duplication of orders and paperwork at the nursing station and pharmacy. Improved overall drug control and drug use monitoring, and a more efficient usage of pharmacy and nursing personnel. Now disadvantages are: it requires increased number of skilled personnel in the pharmacy, and the cost of medication is increased to the patient due to increased handling charges. There are two methods of unit dose dispensing system. First is centralized unit dose distribution system, and second is decentralized unit dose distribution system. First is centralized unit dose distribution system. The characteristic features of centralized unit dose dispensing are that all inpatient drugs are dispensed in unit doses, and all the drugs are stored in a central area pharmacy and dispensed at the time the dose is required to be given to the patient. To operate the system effectively, delivery systems such as medication carts and suction tube systems, also called pneumatic tubes, are required. Second is decentralized unit dose distribution system. This operates through small satellite pharmacies located on each floor of the hospital. The main pharmacy in this system becomes a procurement, storage, manufacturing, and packaging center serving all the satellites. The delivery system is accomplished by the use of medication cards. The procedure is like this. Upon admission to the hospital, patient profile card is prepared. Prescriptions are sent directly to the pharmacist. Then pharmacist checks the medication orders and picks medication order and place drugs in cart. Pharmacist check cart prior to release. The nurse administers the drugs and make the entry in the records. Upon return to the pharmacy, the cart is rechecked. These are some images of medication carts. Now let us see other dispensing method, that is automated medication dispensing. This system works on a computer interface between the hospital pharmacy computer terminals and the dispensing machines at the clinical ward. This system electronically controls and tracks the dispensing of unit doses for each patient based on individual medication profile. The dispensing machines allow medicines to be stored on the ward and to be more conveniently accessed by the clinical staff. In this medication distribution system, medication errors are minimized and it helps in improving medication safety within the hospital. These are some images for automated medication dispensing. Now all of you understand the dispensing of drugs to inpatients and various types of drug distribution systems. Thank you.